heart of Migori County, a vibrant community thrives, but beneath the surface, there is a growing crisis. Mental health, often misunderstood and overlooked, is silently impacting the lives of many here. In partnership with M-Pesa Foundation, Zuri Health journeyed to Kitere village in Rongo sub-county with a mission to provide critical healthcare services, setting up a comprehensive medical camp.
My name's Rodiambo Bronze. I'm from here. I'm based here in Rongo, Central Kamagambo Ward. About the treatment, about the mental health, so far it has been good. The doctors who are here are experienced. They know how to handle issues. They listen very carefully and help you with what you want.
I'm very happy today to attend this medical camp prepared by the Safaricom Foundation. What makes me even much happier is that they gave us a tent for mental health. It's a leap that now people are discovering that mental health is part and parcel of health. You know, like the World Health Organization define health as a state of being physically, mentally, and socially well, and not merely the absence of disease.
One of the things that affects most of as a youth, we are depressed, we are stressed.
You cannot be healthy without a sound mind. We usually say a sound mind is a sound body.
The economy is not good, so most of us are getting depressed on so many issues.
There is substance use disorder. There's people who are addicted to marijuana, tobacco, alcohol, and other substances like cat, mira, and all that. That is also part of mental health.
Some of them are depressed. They are using alcohol, the drugs. So I think if they would have come here, they would have get helped to overcome whatever they are going through. Because to me, I don't believe drug addiction is the way to go as a youth. I think they would have come here to get help, just like me. I really appreciate so much.
I just want to also thank the Safaricom Foundation because in the list of medications, they also included antipsychotics. I can see carbamazepine, chlorpromazine, haloperidol, amitriptyline, and phenobarbital.
About the partnership of the Safaricom and the Zuri to bring this thing here, this is one of the most wonderful things I've never seen. It is good to give back to the community through doing this by ensuring people get free treatment, because there are many people who cannot afford such treatments. So to Safaricom, I really appreciate so much. This is one of the best things I've ever seen.
Mental illness is now part and parcel of the camp as a whole. When Safaricom is holding their camps, there is a place that is catered for mental health.
It is not accessible. Mental health here in Rongo, I've never seen anywhere that is being done. But if in case it is done somewhere, then it's very expensive. It is unaffordable. So many people can't afford to go to an hospital for them to be checked on their mental status.
Limited resources and lack of awareness leave many struggling with mental health issues, unable to access care and suffering in silence.
Sensitization is not very wide for mental health, and I know that as much as the camps will continue, the Safaricom will continue to engage the mental health team so that these thing becomes sensitized, so many people get to know about it.
By this Safaricom bringing this on a free basis, it will help a lot. Someone like me, I was having several things that were disturbing me, but after coming here, I hope the doctor, I will use whatever he has told me, and eventually I will overcome the depression that I was going through.
The government should allocate a lot of money for sensitization, for treatment, and for mobilization on mental health issues, so that people are aware that these services are existing. For the very sick patients, like the major psychotic disorders, like the schizophrenia and spectrum disorders, bipolar and other disorders, neurocognitive disorders, like the dementia, we have also come across them. In Kenya, it has been established that at least 4 out of 5 patients have always at one time suffered mental illness. People usually just compare mental illness to madness, but I don't think that is the thing, because mental disorders are very wide. We have even eating disorders. We have behavioral and gaming disorders. What I want to say is a plus in this medical camp is that the psychiatrists, nurses were recognized, the clinical psychologists were recognized, and we were able to give out our services to those people who needed them.
The people that have missed this event, I can say that they have missed a lot. There were experienced doctors who could have helped them solve their issues.